The state's elective surgery waiting list has blown out by thousands during the O'Farrell government's first year in office. On top of that, people are waiting longer for their procedures. The opposition says the government has failed to deliver on one of its key election promises. Here's state political reporter Eliza Blue.
Public hospitals across New South Wales are gearing up for what could be the busiest winter on record, and the opposition says it's going to expose the holes in the system.
The hospital system will not be able to cope with emergency elective surgery and emergency department figures given the lack of funding that this government's providing.
The latest statistics from the Health Department show the system is already struggling. When the government came to power in March last year, there were about 68,500 people waiting for surgery. That's risen to just over 71,000, or 4%. The average wait for elective surgery has risen slightly to just over 3 months. The opposition says that amounts to a broken promise.
This government promised to cut the waiting lists. This government spoke long and loud about lists that are much shorter than they are now.
But the minister disagrees.
I didn't promise to reduce waiting lists. What I did promise was something much more fundamental, and that was to do more surgeries. Done it.
It's not all bad news for the government. The figures reveal that fewer people are waiting a year or longer for their surgery compared to March last year, and the government is confident that trend will continue. Doctors say the problem is bigger than the numbers reflect.
Elective surgery waiting lists only scratch the surface of the demand for elective surgery in New South Wales.
They say more money would go a long way towards keeping up with the growing demand. Eliza Blue, ABC News.